CEN Exam Prep Handbook. Question 1. A patient with COPD is receiving supplemental oxygen. The nurse is most concerned if the patient's oxygen saturation is maintained at which level? Option A, 88-92%. Option B, 93-95%. Option C, 96-100%. Option D, 85-88%. The correct answer is option C, 96-100%. In COPD patients, the goal is to maintain oxygen saturation between 88-92%. Excessive oxygen can suppress the hypoxic drive and lead to hypercapnic respiratory failure. A saturation of 96-100% is too high and may worsen ventilation in these patients. Saturation below 88%, D, is too low. Question 2. A patient with a diagnosis of bipolar disorder is brought in for mania. Which of the following is a priority nursing intervention? Option A, administer lithium immediately. Option B, ensure the patient is in a safe, calm environment. Option C, restrict fluid intake to prevent water intoxication. Option D, place the patient in seclusion. The correct answer is option B. Ensure the patient is in a safe, calm environment. Safety is the priority. A calm, safe environment with decreased stimulation can help manage manic behavior. Lithium, A, may be prescribed but administration is a provider order. Fluid intake, C, should be monitored but lithium requires adequate fluid intake. Seclusion, D, is only for imminent danger. Question 3. A patient refuses treatment and wants to leave the ED against medical advice. What is the nurse's priority action? Option A, let the patient leave. Option B, notify security. Option C, assess the patient's decision-making capacity. Option D, restrain the patient. The correct answer is option C, assess the patient's decision-making capacity. If a patient wants to leave AMA, the nurse must first assess whether the patient has the capacity to make informed decisions. If the patient is alert, oriented, and understands the risks, they have the right to refuse care. Notifying security, B, is only if the patient is a danger. Restraints, D, are not appropriate for a patient with capacity.
Stressed about your Colorado real estate? We can take Colorado real estate for you remotely and undetected. We always guarantee A-Pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 4. A patient is brought to the ED after a witnessed seizure lasting 8 minutes. What is the priority nursing action? Option A, administer 4-lorazepam. Option B, assess for head injury. Option C, obtain a stat CT scan. Option D, perform a detailed neurological assessment. The correct answer is option A, administer 4-lorazepam. A seizure lasting more than 5 minutes is status epilepticus, a neurologic emergency. The priority is to terminate the seizure with benzodiazepines, lorazepam or diazepam. While head injury assessment, B, and CT, C, are important, the seizure must be stopped first. A full neuro assessment, D, will be performed after the seizure terminates. Question 5. A patient presents with a jellyfish sting. Which of the following is an appropriate first-aid measure? Option A, apply fresh water to the area. Option B, apply vinegar to inactivate nematocysts. Option C, apply heat to the area. Option D, rinse with seawater and apply ice. The correct answer is option B, apply vinegar to inactivate nematocysts. Vinegar, acetic acid, should be applied to jellyfish stings to inactivate the nematocysts and prevent further venom release. Fresh water, A, can cause nematocysts to fire. Heat, C, is sometimes used for pain relief but not for inactivation. Rinsing with seawater, D, is acceptable but vinegar is preferred. Question 6. A patient arrives with a chief complaint of the worst headache of my life. Which of the following is the priority nursing action? Option A, administer pain medication. Option B, perform a neurological assessment. Option C, prepare the patient for a CT scan. Option D, establish 4 access. The correct answer is option C, prepare the patient for a CT scan. Worst headache of my life is a classic presentation for subarachnoid hemorrhage. A non-contrast CT scan is the priority diagnostic test. While neuroassessment, B, is important, the CT is diagnostic and should not be delayed. Pain medication, A, and 4-axis, D, are important but secondary to diagnosis. Question 7. Which of the following is a true statement about do-not resuscitate, DNR, orders? Option A. A DNR order indicates no further care should be given. Option B. A DNR order is a standing order for all patients. Option C. A DNR order is written by a physician after discussion with the patient or family. Option D. A DNR order can be written only by the patient's family. The correct answer is option C. A DNR order is written by a physician after discussion with the patient or family. DNR orders are written by a physician after discussion with the patient or healthcare proxy. DNR does not mean no care, A, it means no CPR. DNR is not a standing order, B. Family, D, cannot write the order but can participate in discussion. Question 8. A patient with a wrist sprain is being discharged. Which instruction is most appropriate? Option A, apply heat for the first 24 hours. Option B, apply ice for the first 24-48 hours. Option C, begin range of motion exercises immediately. Option D, avoid immobilization to prevent stiffness. The correct answer is option B, apply ice for the first 24-48 hours. For acute sprains, rest, ice, compression, elevation is recommended. Ice should be applied for the first 24-48 hours to reduce swelling. Heat, A, is applied after 48 hours for muscle relaxation. Immediate range of motion, C, can worsen injury. Immobilization, D, is needed initially for healing.
Are you looking for Colorado real estate actual questions? Visit our website pokerexams.com to access Colorado Real Estate Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get Colorado Real Estate Answer Key today.
Question 9. A patient presents with the following symptoms: butterfly rash on the face, joint pain, and photosensitivity. What is the most likely diagnosis? Option A, systemic lupus erythematosus. Option B, rheumatoid arthritis. Option C, scleroderma. Option D, Sjogren's syndrome. The correct answer is option A, systemic lupus erythematosus. Systemic lupus erythematosus, SLE, commonly presents with the classic butterfly, malar, rash across the cheeks and nose, joint pain, photosensitivity, and other systemic symptoms. Rheumatoid arthritis, B, presents with joint deformity and morning stiffness. Scleroderma, C, presents with skin thickening. Sjogren's syndrome, D, presents with dry eyes and dry mouth. Question 10. An epidural hematoma is most commonly associated with which mechanism of injury? Option A, striking the head on a hard surface. Option B, rapid deceleration injury. Option C, injury to the temporal bone with laceration of the middle meningeal artery. Option D, acceleration-deceleration injury causing shearing forces. The correct answer is option C, injury to the temporal bone with laceration of the middle meningeal artery. Epidural hematoma is typically caused by a blow to the temporal area of the skull, lacerating the middle meningeal artery. This results in rapid accumulation of arterial blood. Option A is too general. Option B describes diffuse axonal injury. Option D describes subdural hematoma. Question 11. A patient presents with nuchal rigidity, photophobia, and altered mental status. What is the priority diagnostic test? Option A, CT scan of the head. Option B, lumbar puncture. Option C, MRI of the brain. Option D, blood cultures. The correct answer is option A, CT scan of the head. While lumbar puncture, B, is diagnostic for meningitis, a CT scan of the head must be performed first to rule out increased intracranial pressure, which would make lumbar puncture dangerous. Blood cultures, D, should be obtained but after CT, MRI, C, is not the initial test. Question 12. Which symptom is most characteristic of a subarachnoid hemorrhage? Option A, sudden, severe thunderclap headache. Option B, gradual onset of confusion. Option C, focal weakness on one side. Option D, loss of consciousness without headache. The correct answer is option A, sudden, severe thunderclap headache. Subarachnoid hemorrhage classically presents with a sudden, explosive thunderclap headache described as the worst headache of the patient's life. Focal weakness, C, is more common in ischemic stroke. Gradual confusion, B, is less characteristic. Loss of consciousness without headache, D, is not typical. Question 13. A patient with a known history of type 1 diabetes presents with nausea, vomiting, and a blood glucose of 450 mg/dl. ABG shows pH 7.15, HCO 312 milliequivalent/L. What is the priority intervention? Option A, administer regular insulin 4. Option B, administer 4 fluids. Option C, administer potassium. Option D, obtain a urine ketone test. The correct answer is option B, administer 4 fluids. In DKA, fluid resuscitation is the first priority to correct dehydration and improve perfusion. Insulin, A, is given after fluids. Potassium, C, is given after the patient is rehydrated and potassium is monitored. Urine ketones, D, are important but not the priority. Question 14. A patient with Crohn's disease is at increased risk for which complication? Option A, toxic megacolon. Option B, intestinal obstruction. Option C, perforation. Option D, fistula formation. The correct answer is option D, fistula formation. Crohn's disease is a transmural inflammatory process that often leads to fistula formation between bowel loops, skin, or other organs. Toxic megacolon, A, and perforation, C, are more common in ulcerative colitis. Intestinal obstruction, B, can occur in both, but fistula is more specific to Crohn's. Question 15. A patient presents with signs of sepsis. Which of the following is the most important early intervention? Option A, administer broad-spectrum antibiotics. Option B, administer 4 fluids. Option C, obtain blood cultures. Option D, start a vasopressor. The correct answer is option C, obtain blood cultures. In sepsis, blood cultures should be obtained before starting antibiotics to identify the causative organism. Antibiotics, A, should be given as soon as possible but after cultures. 4 fluids, B, are given simultaneously with cultures. Vasopressors, D, are started after fluid resuscitation. Question 16. A patient at 34 weeks gestation presents with vaginal bleeding and abdominal pain. What is the priority nursing action? Option A, assess fetal heart rate. Option B, obtain maternal vital signs. Option C, prepare for emergency delivery. Option D, perform a pelvic examination. The correct answer is option B, obtain maternal vital signs. The ABCs and maternal stabilization are the priority. Vaginal bleeding in the 3rd trimester may be from placental abruption or placenta previa. Maternal vital signs indicate hemodynamic stability. Fetal heart rate, A, is important but secondary to maternal status. Pelvic exam, D, is contraindicated until placenta previa is ruled out. Question 17. The nurse is triaging a child complaining of fever and rash for 3 days. The nurse notices the appearance of blue-gray spots with a red base on the inside of the child's mouth and a maculopapular rash on the face. Where would be the best location for this patient following triage? Option A, return to the waiting room in line of sight of the triage nurse. Option B, resuscitation bay to prepare for intubation. Option C, isolation room on droplet precautions. Option D, isolation room on airborne precautions. The correct answer is option D, isolation room on airborne precautions. The child's symptoms, colic spots, blue-gray spots with a red base on the buccal mucosa, and maculopapular rash, are classic for measles, rubella. Measles is transmitted by airborne particles and requires airborne precautions with N95 mask and negative pressure isolation. Droplet precautions, C, are not sufficient. Question 18. Which laboratory finding is most specific for acute myocardial infarction? Option A, elevated creatine kinase -MB, CK-MB. Option B, elevated troponin I. Option C, elevated myoglobin. Option D, elevated C-reactive protein. The correct answer is option B, elevated troponin I. Cardiac troponins, troponin I and T, are the most specific biomarkers for myocardial injury because they are found exclusively in cardiac muscle. Troponin I is not found in skeletal muscle, making it highly specific for myocardial infarction. CK-MB, A, is elevated in cardiac injury but can also be elevated with skeletal muscle damage. Myoglobin, C, is early but nonspecific. CRP, D, is a marker of inflammation and is not specific for me.
Stressed about your Colorado real estate? We can take Colorado real estate for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 19. A patient presents with acute kidney injury. Which laboratory finding is most consistent with prerenal azotemia? Option A, BUN/CR ratio 20:1. Option B, BUN/CR ratio 10:1. Option C, normal BUN/CR ratio. Option D, elevated CR with normal BUN. The correct answer is option A, BUN/CR ratio 20:1. In prerenal azotemia, decreased renal perfusion, the BUN/CR ratio is typically 20:1 due to increased reabsorption of urea. In intrinsic renal disease, the ratio is typically 10:1, B. Normal ratio, C, and elevated CR only, D, are not characteristic of prerenal azotemia. Question 20. A patient sustains a deep laceration to the palm of the hand. Which assessment finding suggests median nerve injury? Option A, inability to abduct the fingers. Option B, inability to oppose the thumb. Option C, inability to adduct the thumb. Option D, decreased sensation in the small finger. The correct answer is option B, inability to oppose the thumb. The median nerve innervates the thenar muscles, including the opponens pollicis, which allows thumb opposition. Injury to the median nerve will cause inability to oppose the thumb. Finger abduction, A, is controlled by the ulnar nerve. Thumb adduction, C, is controlled by the ulnar nerve. Sensation in the small finger, D, is controlled by the ulnar nerve. Question 21. A patient with diabetes presents with a blood glucose of 550 mg/dl, serum osmolality of 320 mosm/kg, and a serum pH of 7.35. What is the most likely diagnosis? Option A, diabetic ketoacidosis, DKA. Option B, hyperosmolar hyperglycemic state, HHS. Option C, hypoglycemia. Option D, lactic acidosis. The correct answer is option B, hyperosmolar hyperglycemic state, HHS. HHS is characterized by severe hyperglycemia, greater than 600 mg/dl, elevated serum osmolality, greater than 320 mosm/kg, and absence of significant ketosis or acidosis, pH greater than 7.3. DKA, A, presents with acidosis, pH 7.3, and ketones. Hypoglycemia, C, presents with low blood glucose. Lactic acidosis, D, has normal glucose. Question 22. A patient is receiving packed red blood cells. 15 minutes into the transfusion, the patient reports chills, flank pain, and shortness of breath. What is the nurse's priority action? Option A, slow the infusion rate. Option B, stop the transfusion immediately. Option C, administer diphenhydramine. Option D, notify the provider. The correct answer is option B, stop the transfusion immediately. This patient is experiencing signs of a possible transfusion reaction, chills, flank pain, dyspnea. The immediate priority is to stop the transfusion, keep the 4-line open with normal saline, and notify the provider. Slowing the infusion, A, does not stop the reaction. Diphenhydramine, C, may be given but after stopping the transfusion. Question 23. A patient with a known history of diverticulitis presents with fever and severe left lower quadrant pain. Which assessment finding is most concerning? Option A, abdominal guarding. Option B, rebound tenderness. Option C, rigid, bored like abdomen. Option D, a flatulence. The correct answer is option C, rigid, bored like abdomen. A rigid, bored like abdomen in a patient with diverticulitis suggests perforation with peritonitis, a surgical emergency. Abdominal guarding, A, and rebound tenderness, B, are also signs of peritoneal irritation but are less severe than bored like rigidity. Flatulence, D, is not concerning. Question 24. In a patient with suspected acute coronary syndrome, which of the following is the priority nursing action upon arrival? Option A, obtain 12-lead ECG within 10 minutes. Option B, start 2 large bore 4 lines. Option C, administer chewable aspirin. Option D, draw cardiac enzymes. The correct answer is option A, obtain 12-lead ECG within 10 minutes. The priority for suspected acute coronary syndrome is a 12-lead ECG obtained within 10 minutes of arrival. Rapid identification of STEMI allows for timely reperfusion therapy. While aspirin, C, should be given promptly, the ECG is the priority for diagnosis. For access, B, and lab draw, D, are important but follow the ECG. Question 25. A patient is diagnosed with bacterial meningitis. The nurse anticipates the following finding on physical examination. Option A, positive Kernig's sign. Option B, positive Hohmann's sign. Option C, positive Brzezinski's sign. Option D, both A and C. The correct answer is option D, both A and C. Kernig's sign, resistance to passive leg extension with the hip flexed, and Brzezinski's sign, involuntary hip flexion with passive neck flexion, are classic signs of meningeal irritation in bacterial meningitis. Both may be present. Hohmann's sign, B, is associated with deep vein thrombosis.